So this is my case study. We are doing a case study over male breast cancer. We'll go over the cause, detection, and treatment/prognosis. So the most important thing about diagnosing breast cancer in males or men is to understand that it is not very common and what the risks are involved with this type of cancer. Men over the age of 35 should definitely be considered more at risk and could possibly have a clinical breast exam done every year. They should also know how to do a self-breast exam and should be aware of the warning signs of breast cancer. So this particular case study is over a 29-year-old Asian man. He was referred to the clinic complaining of an enlarging breast lump. He had no significant past medical or family history. He was not taking many medications, no alcohol use, normal sex life, did have a smoking history of 5-pack years. Physical exams revealed that he had a 2.5 centimeter round mass in his lower inner quadrant of the right breast. He was an obese person with a BMI of 30.4, normal testes volume. So diagnosing breast cancer in men is done in several different ways. It could be a low-dose x-ray, also known as a mammogram, a breast ultrasound, which of course uses sound waves to image the inside of the breast. If they have nipple discharge, they can collect that fluid and test that, or also do a breast biopsy. But in this particular case, Mammo revealed that he had a 3 centimeter microlobulated irregular high-density mass at the right subareola, and on ultrasound, the regular mass was also at the right subareola, and it measured 4.19 centimeters in diameter. So on this next slide, we have a couple of images, the first being the patient's mammogram, which would be the low-dose x-ray. You can see the mass right there below the nipple, and also an ultrasound of the mass. So most breast cancers in men are ductal carcinomas, and the cancer starts in the milk supplying system of the breast called the ducts. These cancers are usually invasive because they start in the duct and then invade other areas of the breast. Non-invasive breast cancers are rare. Of course, that means they do not invade other parts of the body, and they would start in the milk ducts. The mass in this case had a complex solid and cystic echo pattern with posterior enhancement. The margin of mass was not circumscribed, and a long axis of the mass was parallel to the skin. Ultrasonography also showed a suspicious enlarged lymph node at the right axilla, which measured 1.31 centimeters in diameter. Characteristics of male breast cancer include a painless lump or thickening in the breast tissue, changes to the skin, such as dimpling, puckering, redness, scaling, and changes to the nipple, such as redness or scaling, or a nipple that begins to turn inward. Also discharge from the nipple. As I said before, this patient specifically complained of a mass in his right breast that was enlarging. He had no other symptoms that he reported. So the causes of breast cancer in men could be a close female relative, or history of repeated radiation exposure to the chest, enlargement of breast called gynecomastia from drug or hormone treatments, and some types of infections and poisons. Taking estrogen, liver disease, diseases of the testicles, and rare genetic condition called Klinefelter syndrome. This patient did not report any of these possible causes. It could just be a random case, which of course does happen. It's just rare. Other names for male breast cancer: infiltrating ductal carcinoma. This is the most common type of male breast cancer. Cells in or around the ducts begin to invade the surrounding tissue, and very rarely a male may be diagnosed with inflammatory breast cancer or Paget's disease of the nipple. Breast cancer, as we've said before, is a rare disease. Less than 1% of all breast cancers occur in men, In 2019, about 2,670 men are expected to be diagnosed with the disease. For men, the lifetime risk of being diagnosed with breast cancer is about 1 in 833. Most men that are diagnosed with breast cancer will undergo some form of treatment, of course, to cure the cancer. This will depend on the size and location of the breast tumor, the stage of cancer, and possibly laboratory tests or other results. Surgery, radiation, chemo are all options, but this particular patient underwent modified radical mastectomy for his breast cancer, and the final pathologic diagnosis was a 3.6 centimeter invasive ductal carcinoma, as we discussed in the previous slide, grade 3, and he also underwent chemotherapy with 6 cycles, radiotherapy, hormonal therapy, and took various medications that are all listed on this slide. For references, we did use the American Cancer Society, the Susan G. Komen website. The case report was found on the Korean Journal of Clinical Oncology and breastcancer.org.